agonist. So you have epinephrine. So remember, initial phases we used to use epinephrine 1:1000, 1 milligrams is equal to 1 ml, 0.01 milligrams per kilo every 15 to. So what happens is it is a kind of a systemic onset beta-2 agonist. It usually acts on the larger airway. There might be some limitation over the smaller airways. So when you are unresponsive to the initial management, you can try this. But nowadays we stopped using it because of the better respiratory support, better nebulization technique. We have ultrasonic nebulizer available as well as IV beta-2 agonist. So nebulized form is not studied, only consider treatment for a choice. Nowadays not used frequently because of IV corticosteroid with other salbutamol and other things are available. So I don't remember when the last time I used a salbutamol. Again, yes, fixed dose combinations are there. We give it like a Resputes, you can say, depending upon what we are using, 0.1 milligram per kilo. In severe status asthmaticus, you can go up to 0.3 milligrams per kilo, and more effective in the low doses when we are talking about appropriate nebulization. So what happens is, as I told you, you have 2-3 options. If there is no hypoxia mild, you can use machine driven nebulization, but there is a moderate severe disease with hypoxia, try to use with the oxygen driven nebulization.